Hello and welcome to the Completed Life Initiative's latest symposium, Last Hellos, New Models in Global End-of-Life Care. This symposium asks the question, how do we navigate one of life's most transformative experiences, our dying?
Drawing inspiration from Australian poet Les Murray's observation that these kind of questions summon last hellos. Today's Global Symposium welcomes speakers from Australia to Belgium, the United States to Rwanda, as we explore new models in end-of-life and palliative care.
From the origin of what it means to be palliative in the context of Aboriginal communities, to the scientific inquiry into the effect of placebos, from research into personal narratives of end-of-life visions, to expanding eligibility considerations for medical aid in dying. This two-day symposium invites you to contemplate one of life's most powerful transformative experiences.
Your presence in this virtual space means a lot to us, and we are grateful for you tuning in today. Be sure to stay till the end of this presentation, as there will be an opportunity for you to join a Completed Life Initiative team member and your fellow symposium attendees at our virtual event cafe. Thanks for joining.
Today, I'm delighted to welcome you to our first session of the symposium, Sculpting a Bridge Between Art and Palliative Care in Rwanda, featuring my guest, Samuel Sangwa. Today, Samuel joins us from Kigali, Rwanda. Welcome, Samuel. Thank you so much for joining our symposium session today.
Thank you, Sarah.
I believe there is a Rwandan saying that when you are well, you belong to yourself, but when you are sick, you belong to your family. You work at the African Center for Research on End-of-Life Care, referred to as ACREAL. How do you and your colleagues create community for your patients through art? Will you share a little bit about the work that you do?
Thanks a lot, and hello to everybody, and thanks for having me for this session. How do we create a community? I would say more, how do we create bonds, family, with people we work into palliative care? And I would like really to bring one pilot engagement we did with the community to really bring the issue of palliative care into the community. And basically, we identified a number of artists, creators, contemporary dancer, visual artists in painting, photo, sculpture, and the like. And we asked them, what do you know about palliative care? And at the very beginning, very few of them actually understood. And we realized there was no communication, no dialogue between art and palliative care. And this prompted us to think about a project that will bridge these two worlds. So we brought some artists to a palliative care center to engage with the medical staff, to engage with some patients. And from there, we elaborated on a process to bring palliative care into the community. So you'll see it probably in the video, and it starts with Dada. She's a very talented contemporary dancer. And then we worked with her to say, how do you represent sickness? And she really worked hard to find the dance, the move, how she really comes as a person with some suffering. And all through the performance, she really evolves from really being lonely, and at some point she ends up with extending a hand to the audience, to the public. And at some point, that hand invites all the audience on the set, on the podium, and this is what you see in the last part of the video, where the performers start by dancing, but we collapse what we call the wall between the audience and the performers. We collapse that walls, and the performers invite the audience on the set, and we end up creating one community. So basically the idea behind it is the person suffering is not on another part of life, or we are divided, or there is something, a glass between. No, we are all part of the same community. And this is what we represented with this performance, starting with Dada alone, wearing kind of a blue gown, but we end up in white with everybody on stage, including the audience. And this is how we mainstream all the issue about palliative care into the community. It becomes a subject matter at the center of the community. So we surround the person who's subject to palliative care, but it's all of us at some point who are affected, and we are comforting one another, because at the end of the day, it's how we comfort one another. Later on, we'll talk about the Ubuntu philosophy. It's all about that. I am because you are. It means we support the person who's suffering because is he or she one of us, you know, and we are him. Basically, that's the idea.
sinkibasha kweguka, ariko nutera intambwe nsanga usekera ndizihirwa nk'abandi, ndishima nkamwe mwese. Kuba mfite uburwayi budakira ntabwo binyambura kwishima mu gihe munshagaye, ngo nsanga nsindagize sekere dusabane, nzitahire nizihiwe kandi ntanzika.
La famille, c'est toi. La famille, c'est moi. Ensemble, pour les soins palliatifs.
We add life to days, not days to life. It's not about death, it's about life until the end. It's about humanity, it's about dignity, it's about the human being. If you treat the person, you must treat the disease as well. And that is the most important thing. Thank you. Murakoze cyane.
What an incredible video. Thank you so much for sharing. And it looked like an incredible performance to be there in person for. What would you say are the main themes or qualities of the communities that you build and collaborate with? Your performers seem to be creating communities within their art. What would you say are some of the main themes?
There are many themes, and this also we discovered while implementing the project is empathy, first of all. And this is a key driver. What we realized, working with the artists, each of them at some point came and say, I've experienced this with my mother, my father, my brother, or a friend. So they could relate now. It's no more a subject which seems to be far. Now it becomes closed, it becomes something which we experience every day. And we all realize, in a way or another, we've been exposed to such kind of a situation. So arts and artists wanted to create that empathy and to trigger that at some point, to say, you always need to have that empathy with the person who needs it. That's first thing. Second point is dignity. And this is portrayed by one of the painting of a lady, and the painting is really, really colorful. She's beautiful. She's wearing colorful clothes. It's all about beauty and dignity. It means I can still stand strong even if I'm sick in this. And this is really, really related for us. It's nobody becomes ugly, becomes worthless because they are sick. People still need to look good to stand. So there is also that sense of beauty and dignity, but more importantly, humanity. You need to understand that this is happening in Rwanda, where we had a genocide against the Tutsi, and we really understand, if you take away humanity from a human being, you then restrict this person to only the illness, for instance, because this is how the process of the genocide took place. You reduce a person to a tribe, to whatever, and you are taking humanity out of the person. So in this very same case, we need to be very careful to not only restrict a person to the illness, we still need to have all the person considered in full humanity. So those are the themes which we worked on in this project, with artists trying to bring the audience to develop empathy, to understand empathy. And then after the show, a number of people in the audience and came and say, thanks, you reminded me my mom when she was sick. I wish I would have known earlier what is palliative care. So it triggered that type of feelings, memory, where people now could relate, and also issue, I would say, about dignity and humanity.
It's inspiring to hear you describe performance and art so vividly, and it's such a powerful thing to hear, and also to imagine that this is possible within community. So first of all, I want to thank you for creating this in your communities, and it strikes me that you're really building a bridge between art and suffering, and art and chronic illness, and art and palliative care. And I'm wondering, how do you define palliative care in this context?
Yeah, so for us, palliative care goes beyond the medical setup. I think that's very, very important. Sometimes when we started the project, and then we have Dr. Christian Tizimira who came in, and that was the first thing he said, it's not about called hospital. It's not about medical. Yes, definitely, it's all about providing some medical support, but it's more how we maintain relation with a person. There is this type of tendency to think when you are well, when you are healthy, everything is fine. But the moment you get sick, you change status, you know. But for us, the whole project was, regardless of your status as a human being, we can't deny you your humanity. We need to maintain it, that humanity and dignity. So that was the most important cross-cutting theme which was driving the whole process. at some point. So palliative care beyond the medical setup is how we make and sustain humanity. I think that's the right word. How do we sustain humanity all through the life of a person from birth till death? Humanity needs to be sustained. There's no way at some point you will say we are going to extract you from the society. You are no more belonging to the society. And that was very important because when somebody goes to the hospitals, there is this type of distance at some point. But we say palliative care is important because it sustains humanity. We want you to be comfortable. We don't want you to be reduced to pain only. We are not looking at you only as a pain situation. No, we sustain you into life. You still have your moment of joy, moment of laughter, your connection with your kids, your parents. That's very, very important. So for us, that's what we're trying to bring with this production, is to remind people, regardless of the medical status of a person, humanity needs to be sustained.
When you said we sustain you through life, that was such a vivid and powerful phrase to share, and thank you for putting it that way. You know, really being able to consider that the most important thing throughout life is retaining, as you said, each person's humanity and dignity, and that just because a chronic or terminal illness enters the picture doesn't mean that they've lost those essential elements. And so I'm really grateful that you're redefining palliative care as we know it from purely a medical context to a life context. So I'm wondering, you know, within that frame, how do different art forms translate experience of palliative care in the sustaining life care sense, as you've described it, into the mainstream? How do these different art forms translate well into the mainstream?
Yeah, and we try in the production to bring different art form, because it's a subject sometimes which can be very difficult to apprehend, because we are talking about death, and sometimes people are a bit afraid. So you need to find different ways to bring the issue and to deconstruct it and make it actual for people. So that's why we brought contemporary dance. Contemporary dance is really powerful, and it's called contemporary because it asks questions, today's questions. That's why it's contemporary. It means through dance, through movement, we ask questions. And that's what Dada did at the very beginning. It's a contemporary dance. So she tried to find forms in a dance which will trigger questions into the audience. That's very, very important. And then we have sculpture. And then we have Brave with great sculpture, who really worked on different type of sculpture. You'll see one in one of the picture with a head with the hands or the fingers like this. He tried to portray suffering and something which, when we talk with people in illness, they feel like they are compressed. You know, it's like the head is under kind of a stress and like. And then he evolved and ended up with a woman full in color, beautiful and smiling after palliative care. So the sculpture evolves from the state of pain to a situation of relief thanks to palliative care. And the material and the color he uses really help people to travel from a state to another state. So that was sculpture. And then we had painting, and then we had two, one which was abstract. And again, this is very important. We don't have answer, I would say, but we want people to reflect themselves through art. That's why you have, first of all, an abstract painting. People need to find either a question or a solution or a perspective by themselves through that. That's why we had this painting, which is an abstract one. And then we had another one, which we already show, this beautiful lady standing, colorful, and the like. So that were, we'll say, visual art. And then we brought in video at some point, and we tried to add Dada dancing, actual dancing into the audience, and then video in the background, and then we try to bring them together. So this is all evocation at the same level, because it takes you to people who maybe are no more alive, people who are not there, but it brings them into our space, basically. So through dance, sculpture, painting, video, and literature, very, very important. We have some words by young person and also old. You see it in the video, we actually have a lady who's beyond 65, and then we have another performer who's really, really young. So we really also portray this through the poems and the words and the literature, because we asked one of the artists to write a piece of art about that. So this is how we bring the different form of art. But the whole idea is, this is such a subject, if we want people to embrace it without fear, with confidence, with no misconception, we need to find different windows of art to make them come in easily, and at the end of the day, they own. And each of them can go back home with a piece of art as in his memory, and which will be built on later on in the community when it will be dealing with palliative care or terminal disease.
That's really incredible. And what I'm hearing is that palliative care and art together are transformative. As you described, the sculpture at the beginning before this experience, it was more stark and perhaps expressing suffering and pain. And then the transformation was kind of a resolution of finding contentment or peace. And so I really appreciate how powerful that is. Your colleague at Acreal has said, what struck me about palliative care is the misconception that it starts only when a person is about to die. In reality, it begins when the person becomes sick and continues in the taking care of them, talking to them, and accompanying them. And this idea of accompanying a person throughout sickness is so powerful. And it's echoed in what you've been sharing so far. And I'm wondering, how does art in its various and dynamic forms, as you've described, from sculpture to dance, to music, to writing, to painting, serve to accompany a person experiencing sickness?
So basically, art is life for us. And this is in all societies, in Rwanda or all around the world, when people marry, it's celebration. You have music, you have dance. So it's part of that moment of life. When you give birth, and then we'll see it in all societies, you have people coming, they'll bring you present, they'll bring you gifts, whatever. Here in Rwanda, people will come, surround the newborn, they will sing. We have celebration when they give name and the like. So all these moments, you still have art as part of life. And then when somebody's die, it's the same. People will come at home, They will celebrate the life of the person. We'll have songs. We'll have people speaking. And again, speaking for us, it's rhetoric. It's a form of art. It's kind of literature, spoken literature, or oral tradition. So all of this form of arts. And this is accompanying somebody through all sequences of life. So there's no reason to not have the same when somebody's sick. Being sick is not being out of the journey of life. So that's what probably we bring into this production. It's life is all through the person's journey. And art reminds us that this person remains a human being. The same way we celebrated him when he was born, when he married, when he did accomplishment, the same way we stand with him when the person is sick, you know? And art reminds all of us that this is the same person you celebrated when the person was born, married, and the like. So that's the role of art, I would say, in this exercise. So accompanying a person, it means we are with you. Whatever steps of your life, we are with you in this, you know? And it's very interesting. When we were doing this production, we asked artists to come with how visually this will look like. And we all know, but this is really practice, when somebody visits you, and this, I saw it with my parents and my friends of my parents, you will walk the person out of the compound and then take the person to his place to say, I want to make sure you are safe. Nothing should happen to you between my compound and your place. And funny enough, the person will also accompany you back to say, let me take you also back at your home. And sometimes you will have people going back and forth from a compound to a compound, like, I will accompany you to make sure you are safe. So it's this whole idea about accompanying a person at some point is, I stand with you, whatever steps, whatever status you have today, whatever status you'll have tomorrow, I'm with you and I'll go in this journey with you.
That's an incredible personal, but also communal responsibility to say, to acknowledge that I stand with you and I'll make sure that nothing happens. And that reminds me that the idea of hospitality is really something that you and everyone in your community is building into the fabric of being together, standing together, and sustaining each other's livelihoods. And what strikes me is that regardless of whether you're young or old, it's whatever stage of life that you're in, you're ensuring that at the end of the day, each person is cared for. And I think that's an incredible refined definition of what true hospitality should look like. Another of your colleagues at Acreal has shared that when a person is sick and nearing their last days, it's not a time to cast them aside, but to approach them with extra care and to ensure that hospitality is not lost. So I'm wondering, how does art bring hospitality to or create hospitality for those receiving palliative care?
Art is very important because at some point, and then we saw that during the COVID, specifically, we all survived through art. Basically, all of us had movies, literature, we read books, we listened to music. Art has this power of keeping us alive and connecting us with one another. If you and I, Sarah, watch the same movie, when we meet the first time, and if we discover we watch the same movie, that will establish a connection. It means we had the same experience, because art, it's about a collective experience, and it creates that empathy, I would say, because this is a person who felt the same feeling when exposed to art and the like. And this is hospitality. It means I understand, like, you and I share the same feelings, humanity at some point. We are triggered by the same things, because at the end of the day, art only gives form to our inner feelings. At some point, we cry, we smile, we get upset, we question life and the like. And art has this ability to bring that out of us. But art is not a solitary experience, it's a collective experience. And because it's a collective experience, it connects people. Even when people were into the COVID, but the fact that they were reading books, they will write to one other saying, did you read this book? I recommend it. So collectively, we supported each other to survive that pandemic in a way or another, because we could connect through art, relate, and maintain bond. And for us, that's hospitality. It's the bonding between people. You are in need. It's a difficult situation, but I still there for you. I still lend my hand, my shoulder for you to lean on, and I expect you to do the same. So it's also about that when it comes to arts and hospitality. It triggers the feelings of empathy, of community, which are very, very important, because that's how we collectively survive. That's how we collectively face illness at some point. So this is how arts somehow bring this feeling of hospitality and the need of hospitality.
Thank you for that. I've heard that in Ubuntu, there's a popular phrase, a person is a person through other people, and that's resonating in what you're sharing today. And the incredible work that you and your team do with creating transmissions of communication through different art forms really emulates this phrase. What are some perhaps challenges or unexpected things that have arisen in creating hospitality on the one hand, but also sustaining life through palliative care with art on the other hand?
So what we felt, and for us that was a pilot, but we learned a lot, is how now we take the issue of palliative care and bring it out of the medical setup. How do we make it a conversation and mainstream conversation at some point into our societies? So this is in our daily practices, like in family. How do we take care of each other when it comes to illness? In our communities, neighbors, colleagues at work and the like, and also in our policies. How do we make sure palliative care is mainstream in policies to make sure we maintain dignity, we maintain humanity? For us, it's just the beginning of this journey. Through art, we bring the question into the center place of the village, if I may call it like that. Everybody now can see it. Nobody will say, I'm not aware. We bring it, everybody can see it. We deconstruct all structure which somehow tended to restrict palliative care to hospitals and health facilities, but we bring it to the society, and then we say, let's discuss about this issue. Let's engage on this issue. How are we better as a society this regard, because I think at the end of the day, it's all about that. How are we a better society when we care about each other, regardless of our status, being young, old, healthy or not healthy? How do we take care of one another in this society? And I think that's the Ubuntu spirit philosophy. Like, I'm because you are. I'm in your hands, you are in my hands. What happens to me is responsibility. What happens to you is my responsibility. So I believe this is what we found out, like there is need now to make this subject of palliative care a mainstream one. The same way we had a campaign about health issues, like we believe palliative care deserves the same momentum, the same focus, the same resources, the same capacity, I would say. We need more trained people. We need policies which enables the physician, the hospitality players to really have freedom to exercise palliative care. We need also ourselves to be educated about that, but we need also more arts to raise awareness. We really need this to be an issue which everybody is exposed to.
So I'm wondering how you know, you're pioneering this work in Rwanda and really being a beacon of light and inspiration to everyone around you throughout the world. And so if we are, because you are, and because you are demonstrating leadership and inspiration and ultimate hospitality in your communities, first, how can we help support that you continue to share your message far and wide, and what would you say is the next steps for creating and expanding community through art?
What we did was a pilot in Rwanda, and really we had very positive feedback, but we believe it can't be confined to Rwanda. We really want to engage with artists beyond Rwanda in this, because this issue of palliative care is also against cultural practices, different places, how we relate with death, with illness, different type of health system, public health. It's also about resources. Some countries will have resources, some others will not have resources. So our idea is, let's engage this beyond Rwanda. We will do another project in Rwanda to really expand our pilot, draw some lessons, but we believe we need new engaging artistic production with other artists from all around the world. We are really, really happy to share what we did, but to recreate the same. And we believe what we did in Rwanda, if we share it, other creators somewhere else can do the same. And this is how the artistic community gets engaged into this. And at the same time, they will adapt and contextualize the art form to their own societies. But we believe it's very important to have this dialogue. It's not Rwanda, it's not Africa, it's the all humanity, it's all of us. We all one day die at some point. So it's something we share. It's our shared humanity. So we believe from the pilot, we really want to engage with other artists, other stakeholders. It's a dialogue between policymakers, community, civil society, artists. How do we continue this this journey where we build awareness through arts, where we educate through art, where artists themselves become players of the change, because it's also behavior change, best practices in palliative care, better policies in Africa, in Asia, in Europe, in USA, in America, and the like. So this is our ambition. We believe this is only the start, but we can really amplify, connect, and work with other stakeholders across the globe.
And may it only be the beginning. And thank you for sharing all of those details. It's so helpful to be aware of how our larger community can hopefully step forward and start making those connections with you and your team. As we come to the conclusion of today's session on sculpting a bridge between art and palliative care in Rwanda, I'm wondering, Samuel, what other qualities or takeaways might you add for our audience to leave our session and conversation today?
I think I'll really end up with Ubuntu. I think we are together in this journey. We are responsible of caring for one another. For us, that's very, very important. We really need to take care of one another in this. Whoever you are, wherever you are, whatever your status, we really need to have this empathy and connection. And we strongly believe palliative care is one form of Ubuntu, of that shared humanity. We really need palliative care because that's what sustains dignity, humanity, and empathy among all of us.
Well, thank you so much, Samuel, for joining me today. As we conclude our session, I want to thank you and your team for the incredible work that you're doing to build community and foster hospitality between art and palliative care in Rwanda, and really serving as a leader in this new and emerging offering to different communities. A reminder, an important reminder that art is a part of life, and just as palliative care ought to be a part of life. And so I want to celebrate and thank you and your team for the work that you're doing to inspire and create something new in not only in your communities in Rwanda, but also as an inspiration and a beacon of light and leadership for communities around the world. So thank you so much for the work that you're doing and for sharing all of these important details with us today for the Completed Life Initiative's new symposium, The Last Hellos, New Models in Global End-of-Life Care. And thank you to our audience for joining us today. It's been an honor to share this topic with you, and we are delighted that you're joining us. And we can't wait to welcome you to our next session. So stay tuned and see you next time.